In the boundary, we had wait lists of 3 to 5 weeks in the office, and we had put a huge burden on our emergency room because people who couldn't get into the office for their infected toe in a timely fashion showed up in the emergency room. Mental health, substance use patients weren't getting counseling stuff in the office because there was no time to do it.
And we were, very fortunate to have invited the CEO of the Health Authority to come to our AGM. And we're able to pitch him on this readiness for us to explore these new models of care that have, since the policy papers in 2015. After a good deal of back and forth, he said, yeah, all right, let's do it. Let's take a risk and see what happens.
We developed outcomes we wanted to meet and then hired appropriate staff and developed appropriate ways of working with them to try and meet those outcomes. So the clinics are all working together. The clinics share a social worker through all 5 clinics in the region. One of the areas shares a nurse. The other 2 clinics have a dedicated nurse in each of their clinics. But they all network together and they all work together. So it's really a patient care network. We are working with the Health Authority now to bring in mental health services, public health, home care, either embedded in the clinics or finding ways of working together more closely. So that's what the project is basically about. That there's rural areas all over the province that could benefit from our learnings from this. And we could save them a lot of money. We can give them a lot of ideas on how we approach problems we came on and get them ahead of the game. I think what excites the physicians is it enables us to deliver better care to our patients. And I know it's an oft-quoted thing, but it's the right care by the right person at the right time. And that in turn is unloading the hospital emergency room and is unloading the mental health office. And that's the goal.